check your Facebook, make sure everything's coming through. Hey guys, welcome in. It looks like we are live for tonight's broadcast. Hope everybody's doing great. As you guys are coming in, some of y'all know me as Pastor Ken. Some of y'all know me as Coach Ken. I kind of go by Coach Ken, the wellness preacher. And with me tonight is the lovely Dr. G. Leilani and Becky are guests to us tonight. I've gotten to see Leilani many times, but Becky is really new to me. So we're going to hear their stories. And as coaches, we're excited to have them on tonight. Those of y'all that are coming in, of course, we talk about metabolic health. And this time of year, this is a time of year where, my goodness, we get, we're going to get engulfed with so many sweets. We've got really that since, Halloween? I mean, sugar, food, it's just everywhere. And then we've got New Year's resolutions. Okay, so what are we going to do about that? Well, tonight we're going to work on helping everybody. We're going to tell our stories a little bit and delve into that. And those of y'all that have known me, I'm Ken. I've been a pastor for over 30 years, also now a nutrition coach. And one of the things for me, I got into this because back in 2023, I was diagnosed with diabetes and my health was off the rails. And it had been for years, and I didn't even know it. And what I didn't know more than anything is I was struggling with something called insulin resistance that no one really seemed to be talking about, but yet it is a big dealing with diabetes, blood sugar, dealing with my blood pressure. I had the migraines. Those of you who know me, I had acid reflux. I had so many different allergies that I was dealing with. Then I got diagnosed with obesity and then was dealing with diabetes. And I learned about this protocol from my wife, Dr. G, and you're going to hear from her tonight and a little bit about her story. But because of this protocol, I was able to lose 50 pounds. I reversed that diabetes. I was able to eliminate my high triglycerides. Those were brought back down again. My blood pressure came back down naturally without any medication. It changed my life. And at 54, I feel more like I'm 24 than I ever have before. So without further ado, I want to turn it over to our guest. Dr. G is going to wrap this up as we talk about testimonies, but I'm really excited to hear, in particular, from Leilani. I've kind of gotten to see some of your story, but I haven't gotten to hear all of it. So would you share a little bit?
Yeah. So I found this protocol or program back in October 2023. And I listened for a while. At that time, I was at my highest weight, 246 pounds. I was starting to lose feeling in my toes. I had joint pain and inflammation. I had vertigo. I had skin issues. I had blurry vision. I had a lot of brain fog. And I was really addicted to food, which I really didn't notice till I started this, which was kind of funny. And I just a lot of issues, but the biggest one for me was definitely my energy levels. I was taking 2 naps a day, was never satisfied after I ate. Like I just had to keep eating, a lot of energy crashes. And then the weight gain was my biggest concern because I could see how it was beginning to impact the rest of my body. And so I sat with this for 3 months and wish I hadn't, because by December, I found out I was pre-diabetic. So I was kind of kicking myself for not trying sooner. So January 2024, I started, and in 2 weeks, my husband actually was the one that made the first comment. He noticed a lot of my inflammation gone in my face. And so that was really exciting because I hadn't really felt that different yet. And a month went by. I noticed I was thinking clearer and much sharper. I wasn't napping anymore. That was huge. We homeschool our kids; they're home all day, and so there wasn't really time for me to be taking 2 naps a day. And so as time went on, I finally hit that 3-month mark, and then the weight just started dropping. And in a seven-month period, I dropped 64 pounds. And the numbness in my feet went away, and my vertigo went away, and my brain fog cleared up. I don't have flare-ups with my skin near as often anymore. My gut health improved. I hardly get sick, which has been one thing I've really noticed with this, and understanding now how it impacts your gut health and hormones I understand why now. I don't get as sick as I used to. So it really did change my life. It's blessed my husband. He was diabetic as well and lost 72 pounds and helps my daughter with her migraines. So it's been amazing. I'm so thankful for it.
That's pretty awesome. Now, Leilani, Becky is a friend of yours, so I'm going to invite you to introduce Becky to us tonight.
Yes, Becky is one of the most passionate people I know when it comes to health and wellness. Like we just happened to come cross paths on Facebook and we started chatting, and she was already fired up about health and knew way more than I did. And so her story's different, but her passion to help people get better is pretty amazing. So yeah, awesome. Share your story, Becky.
Well, thank you for the awesome intro. But yes, way back when we were having babies, it was like had no troubles first baby. Second baby, it was like, oh, all of a sudden they are terming, like giving me PCOS. And I'm like, what in the world is this? And went through different kind of ways to conceive or whatever. And then nonetheless, my doctor was like, let's just take a break from everything. And then that's when we ended up conceiving our second child. So I was like, okay, that's weird. Well, then down the road, I was having all this acne issues. And so I started diving into wellness kind of with that. I had went and got my health and life coach certification, which loved that, and started learning obviously more about nutrition, but never really insulin resistance wasn't brought up. So then when I was looking into acne, like root cause of that, insulin resistance really came up with that. And I was like, I literally thought this was only for diabetics. So it's just wild how I'm learning so much more now that it's like, wow, how powerful insulin is and what it contributes to. And I am so excited because literally this week I had my doctor appointment and had labs drawn. And one thing I was concerned about for myself was my dad had a heart attack in his 40s. My paternal grandma, she passed away before I was even born. And my triglycerides were always kind of like trending up. They weren't technically elevated, but they were just like slowly going up. And I was like, I don't like that. I want to get control of that. So I got my lab results back today and they're at 54. And I was like, yay! So
that's awesome.
I'm so stoked about that because literally I thought it was over a year ago I had labs, but it was actually just in February that I had them, and they were in like the low 100s. So from low 100s in February to 54 this week. So, and I started this the very end of August, first part of September. So, yeah.
Wow. So recently.
Yes. Yeah.
Whew. That's awesome.
Yeah.
Wow.
Yeah.
He's awesome.
That's my story.
That is awesome. Well, thank y'all so much for sharing that. I know we'll talk a little bit more about that and how it's all impacted us. Dr. G, would you give us an introduction to you and your journey?
Of course. So we haven't done this in a while, so this is kind of cool. I'm glad to be back here. So I was diagnosed with prediabetes in January 2024. But that is not the beginning of my story. 15 years prior to that, I had papillary carcinoma of the thyroid, so wound up having that removed. But also at the time, I was diagnosed with hypertension and fibromyalgia. So I've been on high blood pressure medications for 15 years. And I was also diagnosed during the time of the prediabetes diagnosis that my high blood pressure was out of control. So even after being on meds for 15 years, it still wasn't working. And so they were going to put me on some cholesterol meds because that was out of whack as well. Another diabetes medication, another high blood pressure medication, and there was another one in there for something. And I looked at my primary care provider and said, hold on. I saw what meds did in the dental chair because I've been a dentist for 30 years. And I thought, you know what? I can fix this. I don't know how, but I'm going to try without medication because I knew that it was a dietary disease. I knew that. But I didn't know quite where to turn to that because, again, we don't learn what insulin resistance is in school, Becky. Just like you said, you knew
Right.
it had something to do with diabetes. That's what I knew. We didn't learn that in school. We learned what insulin was. We learned how, it affected diabetes type 1 and type 2, but we did not learn insulin resistance. So I had to relearn all those things. And along with all that diagnosis from my doctor, there were things happening behind the scenes, and it was happening long before I got that diagnosis. I had skin tags, I had eczema, I had neuropathy, I had, with my fibromyalgia, I had flares constantly where my skin felt like it was on fire. And if anyone's had an autoimmune disease, they understand what a flare is. And I just thought, oh, it's getting, I'm getting older. I had plantar fasciitis that would for over 2 years, did not realize this is all inflammation. And so when I understood what insulin resistance was, these things started to subside. Like you, Leilani, the first thing within the first week or two, my inflammation was gone. And I couldn't understand. I'm like, I was in pain. I woke up every day in pain. I didn't know what it was like to not be in pain because something hurt. My joints hurt, something hurt. But when that inflammation subsided and dissipated, there was no more pain. And then it just went on from there. And I was overweight. I didn't want to believe I was overweight, but I was 5'1". I still am 5'1", but I'm not the size that I was. I was over 225 pounds. I lost 62 pounds within probably a year, but within the first 8 months, I lost 50 pounds. So I saw results pretty quickly. Are they typical? No, maybe not. But the other things that I saw internally happening in the sense of my blood work, things improved, my overall health improved. I could do things that I was not able to do before. Overall energy was up. No more brain fog. My skin tags fell off. All those things that we don't think about. We don't think that that's what's all these little things, these subtleties that can lead to these big things.
Yeah.
So
awesome. Thank you. Well, we're going to get to hear from Dr. G in just a minute too, a little bit more, but I want to throw out a question to the group. It's not on the outline. It's the holidays. I want everybody to be thinking this, and I'm going to throw out a question. I'm going to get y'all to ask you, give you guys a moment, and that is, what is the holiday that you are looking forward to the most right now? What is one? I'm going to give y'all a second, but I want to say right now, those of y'all that are coming in, you're watching, if you're thinking this is something that you need to be sharing, type @ and the name of somebody in the comment section below, or hit the share button, share it to your page. And I'm going to ask that of our coaches and team right here too, to do the same thing. Take advantage of this time to go ahead and be typing @ and sending this out to anybody, any friend that you have, any of your own clients that you think this will be helpful to. Share it to your pages, whatever's there. So what is the treat that you guys are looking forward to? I'm going to put Leilani on the spot first. Leilani, what is the one holiday treat you are ready for right now?
Off the top of my head, it's probably our traditional Yule log that we make.
Ooh, okay,
So,
nice.
Yeah, looking forward to that.
All right.
Never
Becky,
had
how about
that.
you?
I don't know if a Yule log is sweet, but I tend to enjoy my sweets. So my family, there tends to be as much dessert as there is regular like entree food. But as we will learn here soon, I'm like, Thanksgiving was much better on my gut as I had some fiber, but I still enjoyed my sweets.
Right. There we go.
Yeah.
All right, Dr. G, what is it that you're looking forward to? In our home, we always looking forward to treats.
Anything chocolate, first of all.
Yeah.
So the Yule log, yes. So anything chocolate, but I just love eggnog. I love eggnog.
Dang it, you stole mine. I was going to say
Sorry.
that too. Dad.
I have never had eggnog.
Oh my God.
Never. Nothing beats homemade eggnog, I will say.
Okay. Okay.
Absolutely. Man, what am I going to come up with now? You just took that one. Shoot, I will tell you what, for me, the one thing I always loved about these two holidays back to back as a kid, so I don't know what it'll be this year, but I always liked, because we usually had a pumpkin pie both at Thanksgiving and at Christmas. So if I get to have two pumpkin pies, that would be awesome, right? So do what?
I'll make that note.
But yeah, anything sweet. So here's the thing. That really is a segue into this whole issue of metabolic health. I mean, we talk about our stomach, but really, Dr. G, this is really your area when it comes to our overall health. That things that are happening in our mouth is really where our metabolic health begins. And it's just like, how do we miss that? We are always focused here and everything else. But if there's an expensive place medical wise, it's right here.
Yep.
I mean, to tell you what, and all of us as parents that have had to put our kids through braces and all that, and how many cavities, I mean, holy cow, it gets pricey. So I'm going to turn this over to Dr. G for a little bit here. I'm going to pull up some slides that kind of will unpack this a little bit more. If y'all will bear with me just a second, we'll get this up and going, and that should do it. And I'm going to drop us off. Let's see, does that put all of us over here? It does. Yep. We're all there. All awesome. Right.
So I always like to say that the mouth is the window to our metabolic health, because what we're putting in here not just affects our oral health, but it affects our gut and our systemic health. And so I like to always begin with 93% of us are metabolically unhealthy. And what does that mean? What does that look like? How did we get here? So if you have these 5 or more, or these 5 symptoms, or 3 or more of these 5 symptoms, you are metabolically sick. And what that looks like, these are measurable things where you can actually measure them with a blood test. You can also use the tape measure and also blood pressure cuff. So these are measurable things. So if you have a low HDL, if you have a high fasting blood sugar, that means it's over 100, and you haven't eaten anything. If your triglycerides are high, they're over 150. If you have a high blood pressure, that's what it used to be. Actually, it's 130. It's 130 over 85. It used to be a different marker than that. But if you have those things, you are more than likely metabolically unhealthy. But there's one thing that you can actually do with the tape measure. It's fairly simple, a large waist circumference. That means if your waist is larger than half your height. Now, remember I had said I'm 5'1". That's roughly translates to 61 inches. So my waist was a heck of a lot larger than half of that. It was in the 40-inch mark. So I was metabolically sick. I had metabolic syndrome. Now, the other thing about this, if you have 3 or more of these and you are medicated to keep them in check, then you are metabolically sick, because what's happening is that medication is only masking the symptom to manage you. It's not helping to heal you. So go ahead and let's see the next slide, Ken. So what is all this? What does all this mean? Well, if you were listening when we were all talking, things started happening to us long before we got that diagnosis of type 2 diabetes, or we got that diagnosis of hypertension. And things that happened like 10, 15, even 20 years prior to this, like we have increased hunger. We're always eating all the time, can never have the feeling of getting full, always thirsty. We have blurred vision. Acne is another one. Skin tags. Those are not normal. Okay. High blood sugars. It just keeps spiraling out of control. It fluctuates here and there, but you're not really a diabetic or diagnosed as one. Tingling in the hands and feet. I had neuropathy long before I was diagnosed with it. Overall chronic pain, tired, brain fog, fatigue, can't seem to ever have a straight thought. Dry skin patches, those dry areas on your skin they're dark patches. You can't rub them off. That is a condition called acanthosis nigricans. And what happens there is that your skin starts to have those little patches to indicate that there's something going on. And then this over time leads to all these other things that we see in the blue here. It can lead to heart disease, obesity, migraines, dementia, periodontal disease, non-alcoholic fatty liver, arthritis, things like that, high blood pressure, type 2 diabetes. And the root cause of all these things is that one thing that we were talking about earlier, insulin resistance. Go ahead, Ken. So one thing about insulin resistance. Actually, I'm going to talk about what exactly it is before we get into periodontal disease and insulin resistance. Insulin resistance is when your cells do not respond to insulin. It's not a problem with your insulin. It's the problem with the receptor site on the insulin. I mean, on the cell, because what happens is normally when you eat and the carbohydrates turn into sugars or glucose, insulin is then released from your pancreas. Insulin is the key that unlocks the receptor site on the cell to open that door so that the glucose can get in the cell. And that glucose is utilized by the mitochondria for energy. That's where we get our energy. However, if the cell is full of glucose, it doesn't want any more glucose, but insulin still has a job to do. It tries to open that receptor site. It's the key. It tries to open up that lock, that receptor site, to let in glucose. And the cell says, no, I don't want any more than that. I don't need any more than that. So it still has to bring that glucose. Insulin then has to carry that glucose somewhere. And what it normally does is it starts depositing in your bloodstream. And then the body can't use that as energy. And the other areas, it'll deposit it in your other organs, like your liver, your kidneys, your brain, your skin, your heart, your muscles. And over time, what happens is there's a buildup of fat, and it stores it as fat because it looks at it as, oh, we need this for later. So you're probably saying, how in the world is this related to periodontal disease? How is this related to our oral health? How is insulin resistance and periodontal disease related? Go back to that one slide that we just were talking there. So how this is related is periodontal disease. Hold on. Can you go back to the other slide? Thank you. All righty. So with periodontal disease, okay, it is a bacterial disease. And what happens is that those that have been diagnosed with periodontal disease, with that bacteria, the same patients that were diagnosed with diabetes, heart disease, and Alzheimer's disease, it was found to have the same bacteria as periodontal disease in their bloodstream. All righty. So, and again, you're saying, well, how do we get that link? How does periodontal disease, how is it linked to diabetes? How is it linked to heart disease? How is it linked to Alzheimer's? Well, tonight we're going to concentrate on one of those, diabetes, so that we can see how that is a bidirectional relationship. Now go ahead and advance to the next slide. So basically, diabetes, some statistics here is that this is in 2022 by the CDC. This is back in 2022, so it's probably more now. Little more than 30 million Americans were diagnosed with type 2 diabetes, okay? And many of them, okay, did not even know it. Again, prediabetes is also an issue because more than 84 million Americans were diagnosed with prediabetes in 2022. And a lot of them don't even really know that they have it. This is a problem. So when you go see the dentist is often the first line in your healthcare that can diagnose diabetes in the mouth. I've done it before. I see it all the time, and it's dealing with inflammation. And let's talk about that. So first, one of the most common things the questions that I get in the dental chair is, do I have a cavity? And while that's important, and I'm going to go over how that occurs, periodontal disease is also something that you need to be aware of. So how do we get cavities? And believe it or not, this might be something you did not know. There are only 4 things that contribute to dental caries or cavities. And if you don't have one of these things, a cavity will not form. That's a little secret. No one tells you that, but I'm here to tell you that. So first of all, one of the first things you have to have is a tooth. You got to have a tooth in your mouth in order for a cavity to form. All righty. Now, you also have to have bacteria. Now, naturally, we have bacteria in our mouth as well as our body for lots of reasons, to fight off infections and things like that. So there is bacteria in your mouth. All right. But you have to have that bacterial biofilm. And how does that happen? Where does that come from? So when we eat something like a carbohydrate, that's your sugar substrate down there. Okay. So when we eat a carbohydrate, salivary amylase, which is an enzyme in your body, in your mouth specifically, it breaks down those carbohydrates into simple sugars. Well, the bacteria in your mouth love those simple sugars. So what it does is that it consumes those sugars and it produces a byproduct, which is the biofilm, and that is the plaque. And so it's that fuzzy white stuff that is on your teeth, and you can rub your tongue on your teeth right now. You probably feel it. You probably have some. All righty. The other factor in this in formation of a cavity is time. So if the longer that bacterial plaque and its byproducts of plaque sit on your teeth, the more opportunity you have for developing dental decay. All righty. Go ahead and to the next slide, Ken. So how does this work over time? So over time, when we eat, all righty, we form dental plaque, but then that plaque sits on our gums, sits on our teeth. When it sits on our teeth, it'll form a cavity the longer it sits there. The longer it sits on our gums, what happens is it causes inflammation. And that's where we get gingivitis. The longer it sits there, it'll then calcify into what we know as calculus. That's that hard substance that gets on our teeth. Okay. And over time, it causes more and more inflammation. Well, the body looks at this inflammation as a site of injury and it wants to heal. So it sends out the white blood cells, it sends in the cytokines to do a job and heal that area of inflammation. But over time, we continue to eat and consume carbohydrates. What happens is we get more and more inflammation. So the pro-inflammatory cytokines, they kind of get out of whack. And what happens is they disrupt those insulin pathways. When those insulin pathways are disrupted, where the insulin can't unlock that receptor on the cell to let in glucose for energy, the glucose has to go somewhere. Remember, it then increases in your blood. So you have increased blood sugar, which leads to type 2 diabetes. Okay. So when you are a diabetic, all right, you are automatically immunocompromised. Your body can't fight off infection very well. Periodontal disease is a bacterial infection. So you're susceptible to bacterial infections like that of periodontal disease. So being a diabetic, you have a risk of developing periodontal disease, which is why we can see and diagnose this as dentists in the chair long before your A1C levels are high enough to show that you are diabetic. Okay. Now, if you haven't been diagnosed with diabetes, but yet you have periodontal disease, you run the risk of developing diabetes because of the insulin pathways being disrupted and your body isn't processing it like it should. Insulin's not able to do the job that it should. So that's how it's bidirectional. Now, I'm going to turn this over to Coach Ken, and he's going to talk about one of the things that we can do to help prevent this, because you're probably saying, how is this preventable? Yes, it is. It is preventable by doing just one little thing that he's going to talk about.
Right. Well, and I appreciate that. Thank you, Dr. G. So what we want to look at right here out of the gate is to see, how are we eating? And for most of us, we go through, and the modern food environment is we are eating all day long. And the thing about that, it wouldn't be so bad if we could, first of all, cut out snacks. But we just talked about all the things we crave come the holidays, and how many things do we have thrown at us? I mean, I got into the office today, I had candy canes everywhere. I'm like, and you don't think that's much, but every time we consume, our blood sugar is going to increase and our insulin is going to increase. The thing about it is, why is that such a problem? Well, if we look at what our modern food environment is, we're eating all day long. Maybe it's been 3 meals, maybe it's 5 meals, it's healthy snacks, it's 6 small little meals, and you've been eating like a little bird. But the most important thing is fiber has been taken out of our food. Now, we focus on the food pyramid all the time, but in fact, one of the things that studies show over and over again, and it's something that my grandparents taught me, was we should always start with what? Eating your veggies first, right? And the fact of the matter is, study after study is showing that if we would simply change the order that we eat, starting with fiber, getting a good salad, focusing in on proteins and healthy fats, and leaving simple carbohydrates like breads, rice, pastas, corn, and potatoes to the end of the meal, it would make a huge difference. In fact, it doesn't even matter how fast that you eat. One study showed if you would simply add fiber when you ate, it could change how your body is going to process what you're eating, because rather than turning into glucose, as Dr. G talked about, fiber turns into a gel that actually coats the stomach, coats the esophagus, feeds the gut microbiome, provides the body with the probiotics that you actually are been needing. Those probiotics and the prebiotics are all found in those fibers. And over again, we are finding that to be shown in different studies that take place. Now, one of the things that we found is that there's a really simple thing that you can add just to be sure, because getting enough fiber is really important. What we find is whether it's irritable bowel syndrome, whether it's constipation, diarrhea, skin issues, anxiety, depression, or even more than that. Those of y'all that know me know my late wife, Heather, passed away from colon cancer. One of the leading causes of why colon cancer is on the increase, especially for our millennials, is because there's a lack of fiber in our food. And when we change that, it changes everything. The University of Sydney said that when you start particularly this fiber product, it will lower that postprandial glucose spike between 28 and almost 40%. The Cleveland Clinic did a study on the fiber, and they determined that if you would increase and use this fiber, it could potentially decrease the need for lipid-lowering medications. Those are statin medications. So those are really medications number 1 and number 2 that are most prescribed in the U.S. and around the world. So simply changing that in our diets. So that's really a good tip. Even if you didn't start doing this fiber, if you just would start your Christmas meal with a salad rather than rolls and biscuits, you could change your whole outlook when it comes to your blood sugar levels. Now, that's not the only thing. There's actually a second thing that I want to turn this over to Leilani and Becky to talk about, because they've gone through some of this as well. And this is, I'm having a lot of fun playing around, bringing everybody on and taking everybody off. This is kind of a challenge. But I'm going to turn this over to you guys. Tell us a little bit about.
Perfect. Thank you, Ken. Yes, like he mentioned, fiber is a great addition to any meal. But another key thing that we do is we include intermittent fasting. And I know when I first talked to Leilani about this, I was like, Leilani, I cannot go much past 9:30 and I'm hangry. And so she will introduce a tool that helps with that. But I kind of knew a little bit about the benefits of fasting, but I honestly didn't fast much over 12, 13 hours. Which if that's where you are and that's all you can do, that's fine. We definitely meet people where they are and kind of help them and coach them and kind of share where my kind of one more of the benefits are at. So ideally we love to do like a 16 and 8 window. So fasting for 16 hours. So you're done eating supper and then you don't eat until 16 hours later. So I'm usually eating around 11:30 my lunch, 11:30 or noon. But what this does, so as Dr. G had mentioned, like if we have less blood sugar spikes, if we aren't just constantly eating breakfast, a snack, and then lunch, and then a snack, and then supper, and the snack, it's just less time that our blood sugar is spiking. So less time that our insulin has to be released and released and released. So that allows our body to really kind of, it improves that insulin sensitivity for one, which is huge because it just gets a break for once. But in return, it will like turn on that fat burning for you, cell repair. This is what I always kind of like. I just think of like the cells, like they're like getting clean, like brushed up and everything, and all the bad stuff is getting cleaned out of there.
Yeah.
It reduces your inflammation, which all of us have mentioned that. Dr. G mentioned the inflammation in your gums. So yeah, just so many amazing things that can come just from fasting 16 hours. I know some people, they will do extended fasts. Leilani, I know you do kind of some longer extended fasts at times. Women, we have to pay attention to our cycle with that, I know. But what is the big helper to us, Leilani, that helps us fast though?
Yeah, Becky, that was great. And I think I love that you hit on the point that for some people, it's like you're hangry at the beginning. It's really hard to introduce this kind of lifestyle to your body when it's only known one way of living for so long. And that's just existing off of glucose. And so the minute you ask it to kind of burn through all those energy stores, it freaks out and you get really, really hungry and you get moody and irritable. And really it's just your body trying to find more energy. And this is when it's a really beautiful transition that your body actually makes called metabolic flexibility, which is where we all should be. That's how we all should be functioning. When the glucose stores are gone, our body knows how to use fat energy. And so the tool that we love to use to help people who struggle with fasting or just want better mental clarity or help with reducing inflammation or better energy levels, I love it for my workouts. It's just so diverse and so amazing, is a very purified, concentrated form of yerba mate. I think it's kind of ironic. I had never heard of this tea before until 2 years ago. And yet it is something that is consistently consumed in South America and has been for years. And I was telling my mom about it the other day, and she was like, wait, they call that drink the drink of the gods. I was like, yeah,
Yes,
they do. And I've been using it and it literally feels that way. It's just kind of mind blowing how effective it is. It has the incredible ability to reduce your cravings. It really complements the fiber because it helps with satiety. It helps with hormone balance, cellular cleanup, helps your cells become more insulin sensitive, where we're really focusing on reducing all the insulin resistance in our body. And, great aspects about it helps with oxidative stress. It improves airflow in your lungs, and it is full of antioxidant and anti-inflammatory properties. Inflammation, I think, is a big thing for a lot of people at different levels, but so many of us are dealing with inflammation, whether it's fibromyalgia or it's arthritis or it's just, achy joints here and there after workout, they just kind of hurt. So it's been very key, but it really helps with the fasting. So whether your fasting life is just you're going to drop the snackings and the grazing, and you have 3 balanced meals a day. For some, eliminating the snacking is hard enough. And so you sip on this in between your breakfast and lunch, your lunch and dinner. It really fills the gap and it supports your metabolic health. So it's not just this thing that helps you not eat. It's doing a lot internally to your hormones, your cells, and helping your body learn how to use energy better.
Mm-hmm.
Really powerful.
And delicious to boot.
Yes, it is delicious.
Thanks, Ken.
Yeah, thanks, Ken. Unless we missed anything.
There we go. Kicked me off and brought me back on. Okay.
Okay.
Let me bring Dr. G on. We'll get the 3 of us or the 4 of us all together here for a second. So, because I just want to hit, because really we're getting kind of this point about how do we do this? So how does this fit together in a lifestyle? We all can really unpack this really well, I think, because we've all lived it for a period of time and it's changed our lives. And the thing about it is really simple. The great part about this, and I would love to have y'all chime in as I, just kind of take a look at it, that you don't really have to change anything. Mm-hmm. You just start to sip on the tea when you wake up in the morning, right here, and you sip on it during the way I say it is I sip on it all during the morning. I get to lunchtime. If I want to have lunch, I'm going to eat lunch. Maybe I'll take my fiber then. Maybe I'll take it later. Maybe I'll have 2 fiber that day, depending on what the meal is. And then I'll sip on my second tea the rest of the day and then have a fiber for sure before my biggest meal. But if you just kind of look at it in terms of you're going to what I call a 2-meal method, rather than eating 3 to 6 meals a day, we just go to 2. For most of us, that's really doable. And I talk to so many people, they're already doing that. So it makes it so much easier. So we get the benefit of fasting along with the benefits of fiber. And we're getting fibers and fasting in such a way we have the science that backs it up. And, Dr. G can probably speak to that more than any of us here. While, we've gone to, I think Becky and I have both gone through coaching, and we've had additional coaching training. I don't know if Leilani, if you have as well, beyond the classes that we have on a regular basis, we get this every week. But Dr. G just did an incredible job of really outlining what metabolic health is. That's really huge. So I don't know that there's any more need. Let's just have some time to just kind of talk a little bit. I'm going to take off of the screen and give the four of us just kind of a chance. And folks coming in, maybe folks have comments that they would like to share. I'm going to open up that. I want to play around a little bit. This is just kind of fun for me. I've just kind of been still learning this stuff. So if you guys have comments and want to put them up, please do that. I think I actually have a little thing. Watch this. I figured this one out. Let's see if it'll come up. Look at this. Watch this. Look at that. Look at that. Yeah. Look at that. Look what I did.
That's awesome. So Tanya Lee actually said non-scale victories are huge. It's not a question, but it's a comment. I agree with that totally, because I want to remind everyone this isn't a weight loss system. While we've all had our experiences and we've had results with losing our body weight, our body fat, or whatever you want to call it, losing weight, it's not a weight loss system. It's a metabolic health system, and all results vary and they're different depending on how sick you are. And we don't know how sick you are. Our story is our story, but I can guarantee you that because we are able to track this and by a blood test, you will get results. It's just a matter of what is going on with your metabolism and what's going on in your body. If you use these products consistently, and I always like to remind people that they're not miracles, they're nutraceuticals, then you will see results. And I
love that, because when I first started this myself, Dr. G, I really struggled because my main goal was weight loss. I was like, I was sick of the weight. I was sick of carrying it around. I was sick of how it made me feel. But that didn't happen for 3 months. But what I did see was really at the end of the day, what changed my life the most. The fact that I had more energy, my clothes were fitting better, even though the scale wasn't changing. And my cravings were going away, and I was able to not eat after dinner. So it's the small victories because of everything that's happening internally that you can't see, but in time you begin to feel it. So I love that you hit that point. The weight loss is like icing on the cake.
Yeah,
it's a side effect.
Well, we had a comment from Marla that it gave her health back. No more chronic inflammation, brain fog, or other health issues. Her labs were normal, no meds, and feels 20 years younger. So there's that. Rhonda just commented the very same thing. That she concurred with exactly what we're talking about here.
And I believe because your body wants to be in homeostasis, it doesn't want all that excess inflammation and carrying around that weight. It's and because people also ask me, well, I don't necessarily have to lose weight. I just want to, I was diagnosed with prediabetes, and there's this, phenomenon, skinny fat, where we see these people all the time. They look fine on the outside. They are not the stereotypical of what we would think that to have diabetes, but they are metabolically ill. And they're like, well, I don't need to lose any more weight. And I always remind them that your body is going to heal the way it's supposed to. If it's meant to lose a couple of pounds, it's going to. If your body knows what it needs to do, you have to give it the opportunity to heal. And when we're consuming and eating every 2 to 3 hours, we're not allowing our bodies to heal.
Right. That's huge. I think that's one of the most important things. And I'll speak to the guy. It seems like lately it's like there's a lot of estrogen in this room. So, I'm going to bring up the other part of it. And because the reality of this is I'm a testicular cancer survivor, and people don't realize, when you deal with that, you're dealing with this issue of low testosterone. That's something ever since 2000 that, it's kind of always been in the back of my mind that, hey, you know what? My body has to make up for that. And, it was impacting me. I was dealing with the low testosterone. And since I was on this protocol without having to go getting, testosterone boosters or anything like that, or, doing with low T, this has jumped my testosterone back up to levels that have me functioning the way that as a male I should be. And the idea that when it comes to hormones, this is so very critically important. what our bodies are doing, and very simply understanding how our body's working. And we can sit there when we talk about, it always seems to go to dieting, that people are like, well, it's calories in, calories out. Calories in, calories out is important, yes, but hormones dictate and control everything.
Yes.
It's hard to fight those hormones.
Yes.
Yep.
So
Yeah, that's huge.
So one of the other things I wanted to address, that a lot of times I'll have people say, well, my doctor told me, and I know, Ken, you were told this. I wasn't told this when I was diagnosed as a pre-diabetic, because when I asked about what can I do, what can I change, a lot of people get eat less, move more. And the problem I have with that is, while they're telling you eat less, move more, they're not telling you to eat less more of what, first of all. Then we rely on this thing that, the pyramid, because that's our old learning. That's what we go to, not of any fault of our own. That's all we know. So they don't tell you to eat less, more of what, and then move more, but they don't tell you exactly what to do there. So we're interpreting, that's left for our subjectivity to interpret, right? And what got us into this mess is that food pyramid. And so then we tend to follow it in a different way. So we're eating less of what we should be eating more of, which is protein and good fats. And because we think, let's follow that pyramid even more strictly. So we're going to follow that bottom line tier. That's what? Is it 10 to 14 servings of carbs daily? No wonder we look like the food pyramid. So, I mean, it's no wonder. So just want to let eat less, move more doesn't necessarily work.
Right.
Kind of like how I out.
Mm-hmm. And the thing that really blew me away, and I need to get the picture up there, is understanding, because we have this idea. The other part of it is we talk about our macronutrients, and it's always carbs, proteins, and fats, but carbs are very different. We have simple carbs and complex carbs, and those complex carbs are that fiber. And we've got to understand, and you'll hear me say this so many times, fiber may not be essential, but it is beneficial. And that is so very important for people to hear, that fiber is the carbohydrate that helps to control our blood glucose levels. So when you're getting in, and we're going to talk about this really this next little bit, as we're getting into really into this holiday spirit, you know what? Eating and paying attention to where we're getting fiber is so very important in our meal. And I don't know about you guys, what would be, when you guys think of a fibrous food that you enjoy, because sometimes people get in this whole obsession about carnivore, that they just don't want to eat anything. Personally, there are some vegetables I don't want to give up. I don't want anybody telling me. That's the great part about the protocol in this system, is it gives you food freedom. What are some of the things that you guys love that, seem to be getting poo-pooed on a lot lately?
Roasted broccoli. That's my favorite.
Love it. Love it. Absolutely.
Yeah, broccoli's good. Asparagus is big in our house. We love asparagus.
Yeah.
I like squash, any type of squash, pumpkin, chayote squash, things like that.
Oh, yeah. Yeah.
Squash is good.
I remember when I was a kid, my mom will probably remember this too. The first time, I didn't know what it was, but I always had salads with iceberg lettuce. And when I don't know what the deal was, she brought home and she made a spinach salad. And I was like, after that, I was like, when are we going to have the green salad? I was a kid. It wasn't white. It was this dark green. And I was like, man, that's good salad. And it was like going, you can, as far as unless my wife is fixing the cooked spinach, I don't want any part of it. Unless Dr. G is fixing it, I just don't. But when it comes to a salad, boy, give me a spinach salad any day of the week, especially with bacon.
Cool. Yes. Mushrooms, strawberries.
It's strawberries, yeah. Vanilla. Yeah.
Berries of any kind.
Yeah.
Right.
Yeah.
So Shannon posting there, the doctors don't take nutrition classes in school a majority of the time, so they don't know exactly. And Dr. G can verify that.
That is correct.
And for Tanya Lee, she shares about how this whole system, and addressing this the way that we did has reversed her type 2 diabetes, high blood pressure, lowered that off meds, down the 45 pounds, just so much that has changed in her. And the 24/7, she was on oxygen for 17 years and now only uses it at night. I mean, that's
amazing.
Wow.
That's freedom for her.
It is incredible freedom.
Tanya, that's really cool.
Yeah.
Isn't it? It is amazing. So as coaches, and just kind of thinking back over this last week or so, as we kind of come into this, we've got about 10 more minutes, and maybe some of y'all have got questions that might be watching right now. Don't hesitate to put that in the comment. And if you were invited by somebody that's in this group, one thing I want to encourage you is you want to learn more about the protocol, you want to learn more about the system that we've been talking about, please get with them. Message them, reach out to them. That's what we want. They invited you because they cared about you. If you had a friend that shared this with you, okay, even if it wasn't one of the 4 people on here, you need to talk to that person because they did that because they're doing this for you. They care about you. Dr. G taught me about this protocol because she cared about me. I mean, that's personal for us in this house because she cared enough about me to say, hey, I want my husband to be healthy. She was already on that journey. But you guys, we do coach people. We do help people on this journey. What have been some of the common, frequently asked questions or a popular question that you've had this week that's kind of rose to the surface among all the different comments that you've had? Leilani, what's something that maybe you've had that has kind of come up in conversation recently?
Oh, I would say protein, which is something I'm trying to work on. But I frequently, when I'm helping people or working with people, they're very concerned about getting in enough protein if they're going to be fasting. And so I understand that. So that is what makes this actually really unique is this is such a versatile program, if that's the right word, but you can really adapt it to fit your lifestyle. You can make adjustments where they need to be made and it's not going to screw everything up. So the biggest advice I tell people is just to really prioritize it. Try to get, I say 0.6 grams per your desired body weight. If I think I have that right. But really just at least 30 grams your first meal for sure. Get 30 grams of protein in your first meal. So that's where I see that, especially the last month, that's been my biggest question from people is, well, how am I supposed to get in protein if I'm also supposed to be fasting? Right. So in your fasting window, doesn't need to be so big all the time. And Becky pointed that out. You can easily hit your protein and still fast through most of the night, be done with dinner at, the earlier, the better, honestly. Let your digestive system do the work before you go to bed. Most of your fasting's done when you sleep. You wake up, maybe 10 or 11, you have your first meal. You can still get in plenty of protein throughout the day.
Right.
Yep.
Right.
Yep.
Dr. G, how about you? What's been a question that you've been hit with recently?
Let's see. Recently, I've had a lot of people ask me, what are the ingredients? And I always kind of chuckle at that because first of all, it's plants, vitamins, minerals, and food. That's what it is. But I chuckle because whenever I was prescribing medication, or when I prescribed medication, they never once asked me what was in that. Ever.
Yep.
Wow.
So
that puts it in perspective.
Yeah.
I chuckle because of that very same thing. And it's always what's in it. But yet they'll take that medication without question, knowing that there's side effects, because every medication has a side effect or the potential to cause them something. And some of the side effects we don't even know we don't know because we don't know.
But they say them so fast in the commercials, you don't even know.
Yeah, there you go. Exactly.
And everybody's so happy. It's like the best thing in the world. It's like Disneyland every day.
Yeah.
That always gets me right there. I kind of have to chuckle.
Right.
Yeah.
Right. Becky, how about you? What have been something that's kind of rose to the surface for you for your coaching experience?
Yeah, I almost would mimic Leilani, which is like, how am I going to stay full for that long? And so I just always encourage like protein and fiber, like focus on those two things. But also, I've had a couple that have, they've just been excited about the caffeine free tea that we have. They're like, my next box, I'm gonna get the caffeinated one and then the decaf one or the uncaffeinated one for the afternoon. Not that I'm like I can drink the caffeinated one like into the afternoon and be fine and fall asleep fine. But some people are a little bit more sensitive to it. So I've just had some excitement kind of more around that. So yeah, that's been my recent one.
That's awesome. Yeah, I drink it all the way up until I go to bed at 10 o'clock
Same.
at night. Dr. G will tell you, I'll just lay right down and go right to sleep and
Yeah.
wake up in the morning and go right to it. The thing for me is, and you guys touched on a little bit about it when you talked about intermittent fasting. The thing that I've seen a lot lately and had is in intermittent fasting starving. And the thing that I took, as the wellness preacher, this is not Jesus going into the desert for 40 days and 40 nights.
No.
So we're talking about to do this protocol, the greatest benefits are just going to 2 meals. And if you do 3 meals, okay, stop snacking. It's going to be fine. You sleep all night, and it's an amazing thing. You wake up most of the time in the morning. If you didn't, you wouldn't know the difference. The fact of the matter is you fast every night when you sleep. You can go without snacking. It can be done. And doing these things will change it. That's part of what metabolic health is all about, is that flexibility. Well, we're coming to the end of this, and, we're right here at the top of the hour. And, again, I just want to say, if you are invited by somebody, if they shared this live with you, this recording with you, please get with them. If you've got questions about what you've heard tonight, if you are invited by Leilani or Becky, Dr. G, or myself, and you still have questions, please get with us. We are here to help on that journey and guide you through that process. This recording will actually be over on our page on YouTube. So it will be available to record and share as well. It will be up here on Facebook for the next 30 days as well. I want to thank Leilani and Becky as we kind of are closing things out. Does anybody have you get 1 sentence, you get 1 minute. Yeah, we can do that. 1 minute. You get 1 minute. What is a word of wisdom that you would like to share with people that are watching that you can give out to them? Leilani, what do you got?
Don't stop believing in your body's ability to heal.
Awesome. I love it.
Yeah.
Awesome. Becky, what about you?
Oh gosh, this is kind of on the spot, but I'm like, my motto has kind of been like, get comfortable being uncomfortable, just like trying new things and like fasting. Like you can do it. Like you can do hard things. So
yeah,
awesome.
I love it. Dr. G,
what have you got to lose? What have you got to lose?
Totally.
Right?
Yes.
Yeah.
Do healthy together is mine. You don't do it alone. That's the great part about this. You've got 4 people here. We will be there to encourage you. And I guarantee you there are so many more in this community. So, folks, thank y'all for being here tonight. I hope this helps you to start getting through the holidays. Stay tuned. We will have more events. I know Leilani and Becky have been doing lives. Dr. G and I do lives. And I'm just so thankful to get to spend time with both these incredible ladies that have been here tonight and a part of this. Leilani, thank you very much. Becky, thank you. Dr.
Thank
G,
you guys. Good to meet you.
Yes.
And everybody that's tuned in, thank y'all so much. As I say when I get off my lives, go get the day, make it golden, go do your best, and go be excellent to one another. Y'all be blessed and have a great evening.
Bye, you guys.
Bye.
Bye.
See ya.